Afternoon, and welcome to our virtual lunch and learn featuring Distinguished Alumnus Matt Zamosky. I'm Ashley Zaverjalewski, and I have the privilege of serving as Seton Hill's Director of Alumni Relations. Thank you for joining us this afternoon. Today's program is an outgrowth of two alumni engagement opportunities, the Alumni Association Veterans Affinity and the Alumni College. The Veterans Affinity was established in 2019 to connect alumni around a shared background or student experience and provide social and educational programs for veterans and their families. If you would like more information about the Veterans Affinity, please contact the Office of Alumni Relations. We're proud that the Veterans Affinity is co-sponsoring today's program with the Alumni College. At this time, I'd like to introduce my colleague, Assistant Director of Alumni Relations, Callie Arita. Callie will share more about the Alumni College and introduce our featured speaker.
Thank you, Ashley, and good afternoon, everyone. Thank you so much for joining us this afternoon. The Alumni College advances the university's mission by providing graduates with stimulating programs that support their journey of thinking and acting critically, creatively, and ethically as productive members of society committed to transforming the world. The Alumni Office has been very excited to have launched the Alumni College this past February because it has given us the opportunity to bring together the lifelong learning opportunities already available to alumni in a comprehensive format, including our Lunch and Learn program. The Lunch and Learn features subject matter experts offering a bite-sized presentation and question and answer on a variety of topics. This afternoon, we are very excited to be joined by Seton Hill alumnus Matt Zamosky, who will be offering his talk titled Veterans Benefits. Before I introduce our guest speaker, I do want to share just a few housekeeping items with everyone. Please be mindful that your mics were muted upon entry for better sound quality. There will be some opportunity for conversation throughout today's presentation, so you can control your mic by hovering over the bottom left corner of your screen and clicking on the mic button to mute and unmute yourself. For better sound quality, we do ask that you please remain muted when you are not speaking. Should you have any questions throughout today's program, please feel free to enter them in the chat function, and they will be received by the event hosts and co-hosts. And we will do our best to cover as many questions during today's Lunch and Learn. Lastly, we just ask that everyone please be mindful that this session today is being recorded. To be mindful of everyone's time, we hope to do our best to keep this program to an hour. So at this time, I would like to introduce our speaker for this afternoon. Matt Zamosky graduated from the adult degree program at Seton Hill in 2010 with a degree in human resources. Prior to graduating from Seton Hill, Matt served 20 years in the United States Air Force, retiring at the rank of Master Sergeant in 2006. Currently serving as the Westmoreland County Director of Veterans Affairs, Matt works tirelessly to raise awareness of the benefits and services available to military in our community. Matt is an executive board member of the Pennsylvania State Association of County Directors of Veterans Affairs. He serves on the Pennsylvania Veterans Foundation Board of Directors, is a deputy commander of the 31st District of the American Legion, serves as co-chair of the VA Pittsburgh Healthcare System Veterans Advisory Board, is a member of the VFW Post 33, Chapter 98 of the Retired Enlisted Association, and American Legion Post 982. He is a co-founding member of the Seton Hill Alumni Veterans Affinity, serves on the Seton Hill Social Work Advisory Board, and was previously a member of the Alumni Advisory Council from 2014 to 2017. He received the 2020 Distinguished Alumnus Award for military service. We extend a special thank you to Matt for sharing his time and expertise with us today. Please join me in giving him a warm welcome.
There we go. Can you hear me okay? Okay, good afternoon. I'll try and live up to the hype. Anyways, My position as Director of Veterans Affairs is established in Pennsylvania law. Every Pennsylvania county has a director such as myself. And I know some of you are from out of state. Most states require that counties have a Director of Veterans Affairs. In Pennsylvania, we're also required to be a Veteran Service Officer, which means that we have to have accreditation with the VA to do claims. Legally, there are 3 types of accredited individuals that can do claims: a Veteran Service Officer, and an accredited attorney, or a claims agent. An attorney or claims agent can actually, if a claim has been denied, they can take a portion of any retroactive payment, usually up to 20%. A VSO, we cannot charge for our services, and we can't take any portion of any payment. So I would suggest anybody looking for help with a VA claim, start with a Veteran Service Officer. If your claim proves too difficult for the individual you're working with, then I would explore an attorney, or, well, an attorney more than likely. In Pennsylvania, county directors, the lion's share of what we do day to day is VA claims, but we're also responsible for county benefits, which are normally related to burial or headstone allowances. We provide the flags that you see flying in the cemeteries. In Pennsylvania, they're supposed to fly from Memorial Day through Veterans Day. However, a cemetery can take them down after the 4th of July, but they have to be maintained so that if a family or a veterans group wanted to put them back up, they can. We kind of sometimes get lumped into human services because we work with people, but our offices are also a liaison to the veterans population for the commissioners. We have a direct working relationship with the Pennsylvania Department of Military and Veteran Affairs, and we also more often than not work with the VA directly. I'll talk briefly about state benefits. I don't want to go into too much detail because, again, a lot of you aren't here or aren't in Pennsylvania. Pennsylvania veterans benefits, the most sought is real estate tax exemption. So any wartime veteran, or they will also look at certain expeditionary operations, who is rated 100% or permanently and totally disabled. So you don't necessarily have to have a percentage of 100 to be considered permanently and totally disabled related to service. If they meet certain income requirements, their property taxes can be excused. And obviously, for obvious reasons, that's pretty beneficial to the individual. That is the only state veterans benefit that is in the PA Constitution. So there are some changes that we'd like to see made to extend those benefits to certain individuals who are excluded because of the wording. Not because people don't want to help them, but just the wording, but because it's in the Constitution, it's very difficult to change. The state also pays disability pensions to paralyzed and blind veterans. They have a Veterans Temporary Assistance Program that is funded entirely from the allowances that you can donate when you get your driver's license or license plate renewed. And then they're talking about a lottery ticket, and there's some other funding streams that go into that account, but it's not funded with tax dollars. There is an educational gratuity program that they can pay for the children of fully disabled veterans, and then, or those who died in service. And there's also the specialty drivers, or there's a veteran's license plate or driver's license and the specialty license plates, sorry. And recently the state law launched what they call PA Vet Connect, which is kind of a database. Right now they call it an Excel file on steroids, but ultimately I think they're looking for a proprietary platform to put the program on, so it'll be a little more usable or interactive. But that is out there. There are individuals directly related to that program who work in the regions that the state was broken down into. I'm going to focus most of my time on federal benefits because that's what most people have questions about, and that's the lion's share of what we do on a day-to-day basis. The VA is kind of like the military. The Department of Defense has the Army, the Navy, the Air Force, and so on. The VA has the Veterans Health Administration, the Veterans Benefits Administration, and the Veterans Cemetery Administration. There's a little bit of interaction, but there's not as much as there can be. I often get veterans saying, well, I told my provider this, and yet, or I changed my address with my doctor, but my claim mail is still going to my old address. Again, they don't fully talk to each other. So unfortunately, until there's a little more, they are looking at merging their online platforms. I think that will happen in the coming years, but right now it's still, it's I guess, the bureaucratic process that it's always been. Federal benefits, to simplify them, they can be broken down into two large groups. Either they're related to service or they're not related to service. And when things are not related to service, the VA will typically look at monetary, whether that's income or assets or both, to determine if somebody would qualify for those programs. Eligibility is normally based on service, but for non-service connected things, there's usually some type of qualification, and usually there's a financial component. I'll start with the Veterans Health Administration. So if a veteran has a service-connected disability of 10% or more, or they served during certain areas, the most common that we see is Vietnam, but also the Desert Storm, those who served at Camp Lejeune. There was a water toxicity problem for the Marines who served at Camp Lejeune for more than 30 days. And they do extend the benefits to Purple Heart veterans, veterans who served during nuclear testing, things like that. But those veterans can get into the VA healthcare system outside of means without their financials being considered. For those who don't fall under that, the VA will look at their income from the preceding year. They use an adjusted gross income. So they would look at the gross household, less unreimbursed medical expenses, education expenses, or if there were funeral expenses for somebody in the household. Most often the expenses are self-reported. The income self-reported, but they will check that against the IRS eventually. Usually that takes months, and then there may correspond if it doesn't, if it would have made a difference in their determination. For Pennsylvania, the geographic means, or for Pittsburgh, the geographic means are for a single veteran for priority group 7, meaning that's really the limit, is $46,500 for a single veteran. For a veteran with one dependent, it's $53,150. Veterans within 10% of those means, and mathematically it doesn't work out exactly right to 10%. I'm not sure how they calculate it, but priority group 8, they will let those within 10% in. Their copays may be a little different, and that is for a single veteran, it's $51,150, and for a veteran with one spouse, it's $58,465. So they're not extremely restrictive, but they are semi-restrictive. A working age veteran may not qualify as easily as somebody who's retired and on a fixed income, but applying is a moment in time. So if you're denied now, but your economic factors change in 2 years, you can reapply and they can let you in. Typically, once you're in, they may change your priority group, but they won't remove you unless you miss a series of appointments, or for some other factor. You don't provide means when they ask for them or something like that, but normally once you're in, you're in. Moving on, well, I'll talk about some of the things that are available in the Veterans Health Administration. The VA is not insurance; it's an administration. So most veterans who use it in conjunction with their civilian insurance. Some veterans use it for their medications because the VA doesn't have a donut hole. If you're paying co-pays for prescriptions for anything formulary, it's between $5 and $15 a month. They can provide ramps, they can provide stair lifts, they can do all those things. To maintain enrollment, a veteran merely needs to go there once a year for a checkup. And typically, if they've missed after 3 years, they'll fall off of, they'll have to re-enroll to get in. But like I said, a lot of veterans use a hybrid. With the VA, we do have a local clinic, and it's true throughout the country. They may have a local clinic that does primary care and some specialties, but more often than not, most of the specialized services are available in the hospitals. For us, it's Pittsburgh. We do have a few veterans in Westmoreland that use Butler or Altoona, but for the lion's share, use VA Pittsburgh. We're fortunate here. Pittsburgh is the top tier of VA hospitals, so they do organ transplants and things like that. I think, to the best of my knowledge, there's only 5 hospitals in the VA's healthcare system that do that. We're in the catchment area of one of them. The other thing that we deal with probably even more often than the Veterans Health Administration is the Veterans Benefits Administration. And that's when you're talking about, and I'll go into service-connected disability, which is any condition caused by or aggravated by service. They can be awarded several different ways. Direct service connection would be, I injured my knee while I was in the service. It's a chronic problem. I filed a claim for it. And the VA weighs it or looks at how badly compromised my knee is and assigns a percentage, and that's compensation on a direct basis. Secondary compensation could be because I injured my knee, favoring my other knee, and over time that knee degrades. And if medical evidence supports that, they can service connect that on a secondary basis. There is also what's called presumptives. There are conditions that the VA will presume are related to service. Anybody who served on active duty that contracts ALS, active duty for 6 months for other than training purposes. Lou Gehrig's disease is presumed to be caused by service. There is no known cause for this, but statistically, a veteran is twice as likely to get ALS than somebody who didn't serve. So with veterans law compensation, our burden is as likely as not. A 50% probability is what we would need to meet to establish service connection. And because the likelihood of acquiring Lou Gehrig's disease has been doubled, they'll concede that it's related to service. There's no progression. If you're diagnosed with Lou Gehrig's disease, it's at the 100% rate. Presumption is also very common with Agent Orange. You often hear about Agent Orange. Agent Orange is a nickname that was assigned to herbicides used in the jungles of Vietnam. There were several different agents. There was Agent White, Agent Blue, Agent Brown, I believe. But the common ingredient was dioxin, and dioxin is known to cause a lot of medical conditions. So there are conditions that are presumed to be caused by Agent Orange. Anybody who served in country, the VA will concede exposure. It doesn't matter if you were a crew chief on an aircraft, that aircraft landed, you got off for 2 seconds, got back on. If there's a paper trail that put you in Vietnam, even if it was only briefly, The VA will concede exposure in any of those conditions that are presumed to be caused by Agent Orange. They will service connect. The most common we see is type 2 diabetes, followed closely by coronary artery disease. Those conditions are common in men of that age, and the lion's share of Vietnam veterans are men. So that's kind of what you see. There are also some cancers. The hairy cell leukemia is the most common that we see is prostate cancer. If you go online, if you just Google VA presumptive conditions for Agent Orange exposure, the VA site really does have a good list of them. There is an independent medical board that recommends conditions be added. Recently, 3 conditions were added: bladder cancer, Parkinsonism, which is Parkinson's had been one of the conditions for a long time, but they also added Parkinson's-like conditions, including Lewy body dementia, and just having the symptoms of Parkinson's without a full diagnosis of Parkinson's. They also added, what was the other one? Hypothyroidism, which is a condition that is typically rated compensable for a period of time, and then if everything normalizes, they will rate it at 0%, which just means there's no monetary assignment to it. They also extended service or coverage for Agent Orange presumptives to the Navy veterans who served in the Tonkin Gulf and off the coast of Vietnam, which for a long time were denied. They had always conceded that the veterans who served in the rivers of Vietnam were exposed, but they distinguished. They had what they call blue water and brown water. The brown water would be in the rivers, the blue water would be in the Gulf, and the VA lost a couple of lawsuits based on the law not specifying. They just said, the law just says served in Vietnam, and the VA did not concede that those international or those territorial waters, the Vietnam territorial waters, were considered Vietnam, but the courts kind of compelled them to, and the VA did not appeal it to the Supreme Court. They had gone up all the way to that, and then ultimately there was legislation drafted that changed that anyway. So now those veterans are included, and presumptives exist in other places. There are presumptives for Desert Storm veterans. I'm not going to get into those. There's also presumptives for the Marines that served at Camp Lejeune. I'm not going to get into those. They're not as common as the Agent Orange presumptives. The final way that somebody can get compensation is through what's called 1151, and that would be basically what's considered a tort claim. In rare cases, if the VA made a gross medical error, it's almost like a malpractice suit. They can pay compensation, but the ancillary benefits that would go with compensation aren't there. It's just monetary. We don't, in my 11 years, I've probably been involved with maybe 3 or 4 of those, and they're very difficult to prove without, strong medical evidence. That's service-connected disability. The VA also has, and we do a lot of these claims, what's called non-service-connected disability. Those are pension claims. These come into play more often than not when a wartime veteran or the surviving spouse of a wartime veteran needs to go into long-term care, needs to have caregivers come into the home. As it is not related to service, there is an income limitation of, it's 138, or the wealth limitation is 138,000 and change. They use the same number that Medicaid uses. It does change every year. They also, the income is basically, they use an adjusted gross. So they look at the gross household income, less predictable medical expenses, which usually include the cost of care, the cost of Medicare, and the cost of medical insurance. any other medical expenses can be claimed annually, if the benefit's running, but they don't use them for predictive purposes because of the way the laws are written. If they overpay, it creates a debt. So they do their best not to create a debt because it creates a situation for the claimant. But for a veteran, a special monthly pension with need of aid and attendance, and aid and attendance is a distinction. It just means that somebody needs help with their activities of daily living. The VA can pay aid and attendance several ways, but the most common we see it is in relation to pension. The highest level of pension is considered aid and attendance, and generically out in the personal care homes and amongst the caregivers, they just call it aid and attendance. That benefit for a single veteran can be up to $2,050 a month. For a married veteran, it can be $2,431 a month. And for a surviving spouse, it can be up to $1,317 a month. If you consider the average price for a personal care home is probably somewhere between $3,000 and $4,000. It can go up from there, but that's a significant amount of money, and it can be the difference between somebody being able to afford care and not. Given the fact that our veteran population in Pennsylvania, the median age is about 67. We see it a lot. We have a lot of older veterans. I did a claim for a surviving spouse who was 105 last month. I had somebody who was 90, I think, call me a day or two later and was, complaining about, saying, well, I may not be here when they make a decision. I said, well, I just did a claim for a woman who was 105. She could have babysat you when you were little. So, but it's an interesting job. The laws are variegated. They apply to veterans differently because of the way the laws are written. Some are situational. You have veterans that say, well, my neighbor has more money than me. Why can they use VA healthcare and I can't? That can come down to, simply they have a service, something service connected. Some, caveat in their service allows them to use the healthcare. And people don't always talk about their disabilities. So, you look at them and that they use it, but, everything doesn't apply equally. I am open to any questions that you may have.
And please know, if you're not comfortable unmuting yourself to ask your question, like I said earlier, feel free to enter them in the chat, and we can kind of ask them on behalf of you.
I will say, earlier I talked about accreditation. I think if any of you are veterans or have family members that are veterans, regardless of where you live, if somebody is offering to help you with the claim, the first question I would ask if they're accredited and how they're accredited, if they're an attorney, if they're a claims agent, if they're a VSO. Again, I'm a veteran service officer. So obviously I may be a little biased, but I would also say, looking at it as an outsider or trying to look at it impartially, a veteran service officer can never charge. So they really don't have, you're not going to have to pay in the long run. Accreditation can be given to veterans organizations. Certain nonprofits have accredited VSOs. The most common are the larger veterans organizations, the American Legion and VFW, and state and local government. No matter where you live, most counties would have a Veterans Affairs office, and in that office, more than likely, they would have an accredited VSO. Some states structure it so their state offices spread throughout the Commonwealth. Some have both, but there is help available. You can always check somebody's accreditation online. If you Google VA accreditation, There is a platform through the Office of General Counsel, which is the VA's legal arm, where you can put somebody's name and their zip code and see if they're accredited with the VA. There are people who work in the gray area who may have, we're seeing a lot with caregivers right now. I can't specify any names or anything, but there are people who will subcontract care. They will become the caregiver. They're paying wholesale, they're getting retail, they're doing a claim, and they're telling individuals, hey, you don't have to pay until your VA claim goes through. From what I've seen locally and in speaking to my counterparts, what a lot of them are doing are, if they're doing the claim, they're making so much per hour in care because they're paying less than they're getting. So ultimately, when they do get paid, they're making that in perpetuity. But they're also guaranteeing, like they're having one of the claimant's children or somebody else basically co-sign, and they're using it kind of like a loan. So that would be due even if the claimant passed. If the claim was denied, those monies would be owed. So there's really no free lunch as far as care goes. If somebody's providing it, they're more than likely going to expect payment regardless of whether the VA pays or not. If you ever have questions about something locally, you can always call our office. Any county in Pennsylvania will have a Veterans Affairs office, which can help. Again, and I think we had a couple participants from Virginia and one from California. I do know that California does have county offices because of a coworker previously worked in one of those offices. I'm not sure about Virginia. I believe they do, but I can't recall specifically whether they do.
Matt, we did have one question come through in the chat.
Okay.
This person is asking, my grandmother is the spouse of a Navy veteran who did not serve during any wars. And just wondering if you can clarify if she might qualify for aid and assistance and attendance.
Well, he didn't have to go to war. The date would have to correspond, at least one day would have to correspond with a congressionally recognized period of war. So if the Korean War, the stop date of the Korean War is January 31st of 1955. So say he went in on January 30th of 1955 and served for 2 years, or really at that point the requirement was 90 days of consecutive service. So even if he didn't go to war and the date just corresponds with an acknowledged or recognized period of war, then yes. If it's outside of a recognized period of war, then no. The law is very specific, and I've actually had a veteran who went to war, she's served for a very long time, but later was in the Guard and Reserves and was activated for a very brief time, and the requirement was 90 days and only had, I think, 50 something days, but was actually in the Middle East in the war theater and didn't qualify for that benefit. So it is very subject to the constraints of the law, but I wouldn't not apply or not ask somebody, whether or not I should apply. I would, certainly show the discharge to a VSO, a veteran service officer, before I wrote it off, because, the surviving spouse at $1,317 a month, that's a pretty fair amount of money. There are also when we talked about compensation, I didn't go into it, but there's also what's called dependency indemnity compensation. And that's when a veteran either dies in the service or dies as a result of something that could be related to service. So, you talk about somebody who was in the Navy, depending on what that veteran did in the Navy, could they have been exposed to asbestos or something like that? And if they died of lung cancer and there were nodules in the lungs that indicated exposure to asbestos, then it's possible that the surviving spouse could get DIC. That benefit does not consider income. And then on top of the base DIC, which is $1,437 a month, the VA can pay an aid and attendance allowance, which is, if I remember correctly, it's $356. So if you look at those two together, you're looking at almost $1,800 a month for somebody. So, and that, again, just something like that is something that somebody who's not accredited probably wouldn't know. What I see more often than not is the people who aren't accredited work in the pension space, and they say, well, if your situation is this, you can get that. But they're hyper focused on one benefit. They don't have any requirement for recurrent training because they're not really authorized to do the job that they're doing. The way the federal law is written, it says that you can help one person one time, and that's okay. So like if you helped your grandmother do a claim, that's okay. But if like 7 or 8 of your grandmother's friends said, wow, you really helped her, can you help me? You're not supposed to do that. Now, if you're not being compensated for it or whatever, I don't think really anybody's going to hold it against you. There are some people too in the field that will actually do a claim and they'll send it through a VSO before it goes into the VA, so like even the American Legion, if the American Legion in your neighborhood doesn't have an accredited officer.
I want to ask a question, but I don't know how to pull up questions.
Sure.
Bernadette, go ahead. You can, if you're comfortable just asking the group, you can go ahead and ask now that you're unmuted.
Okay. I'm actually a retired lieutenant colonel, and I served on active duty and then went in the reserves and retired from that in 2005. And I have a glioblastoma. I was wondering if I could get a service rating for that.
You may. We would have to, there would have to be some type of connection, something. Normally, for most conditions, they look at when the condition was either diagnosed or started. For most conditions, it's within either in service or within a year of separation. But depending on the condition, depending on where you served and when you served, if there is some type of exposure that would make you more predisposed to having that condition, then you could, so I wouldn't say no. I wouldn't say yes. Basically, it depends.
Okay.
With cancers in general, they normally rate them for 1 year or 2 years from the date of diagnosis, and then they'll reevaluate them because cancers often can be either removed or go into remission. If a cancer is, fully, and I'll use prostate cancer because that's definitely the most common cancer that we see because of its relationship to Agent Orange and it being a very, common form of cancer. It's also one of the most treatable. So when a veteran is diagnosed with prostate cancer and it's service connected, basically they'll go 1 year from the diagnosis and then they'll reevaluate. If the cancer is still active after that year, they may set the clock for another year or another 6 months, depending on when the exam was. Once cancer is no longer active, then they'll look at residuals. With prostate cancer in particular, and I know that's not what we're talking about, but just as an example, prostate cancer very often has effects after, such as urinary incontinence. You find yourself going a lot more frequently, and there's other conditions that can come into play. So the VA can rate those residual effects even if the cancer is not active. And that would, those residuals would be kind of like when we talked about secondary conditions. So, if you're local, I'd be happy to talk.
I'm the California person.
Okay.
I'd like to get in contact with the San Mateo County Veteran Service Officer, but I haven't been able to do that.
I would definitely recommend doing that. I couldn't promise anything. Now with retirement, you get if you retired for time, it is for pay purposes, it gets a little weird with the DoD. So if you're 50% or above, you can get both your retirement and disability. If you're below 50%, they'll take your disability out of your retirement unless it's combat related. So but with something like that, I would still look at it because, and I talk to veterans all the time. A lot of time, very often veterans don't want to apply for something because they feel like there's people who are more deserving. And
Right.
Veterans benefits are an entitlement. They're kind of like Doritos. The crunch they'll make more. They have to pay it. So if they didn't budget enough money, they have to find the money to pay them. But there's also advantages for, if you're married, if you have a spouse, establishing service connection for a condition. If that condition is listed on a veteran's death certificate, that opens the door for the DIC that we talked about for the surviving spouse. So if the VA had already acknowledged that that condition is connected to service and it's listed even as a mitigating factor, not as a direct cause of death, but just a contributing factor, the VA will consider that a service-connected death and they will pay DIC to the surviving spouse. So it can be beneficial. Things like VA healthcare can benefit veterans in general. Just, if a veteran doesn't want to apply for that but does, and then doesn't use it too much, the VA is funded they get a certain amount of money for each veteran that's enrolled in the healthcare system. So if one veteran isn't using their allotment, there's more money available to all the other veterans that are enrolled in that local system. So towards the end of the year, there's more services available. So there is certainly an incentive for somebody who isn't going to use the VA for everything to apply. They're not taking away something from other veterans. They're actually possibly benefiting those veterans that are local. So, but I would certainly encourage you to talk to a veteran service officer in your area. Sit down. If they don't give you the answers, or if you don't feel comfortable, it's just like anything else. If you go to a doctor and you don't feel like that doctor is, the right doctor for you, then, you may want to talk to somebody else. But I would certainly suggest starting there. And, if you feel comfortable with the individual, certainly take their advice. And, if you do proceed with the claim, they should be able to help you. Any further questions? I feel like I'm rambling a little bit, but there's a whole lot of stuff that goes on. If you work with veterans, there are locally, we manage transportation to get veterans to the VA hospitals. That's true in a lot of areas. So if you do work with veterans, and there can be local programs that will get them to the VA hospital if they no longer drive. Our vans normally can hold 10 people, but since COVID, the VA's limited us to 4. It's actually their program. We just do the scheduling and find volunteers. So they have US government plates on there. I can't even drive the vans that we have because I'm not accredited I'm not vetted as a VA volunteer. So, but I would encourage anybody to, look locally if they have questions about anything. Often there's things that are unique that maybe we didn't go over that would, apply to somebody. I've had veterans come in for one thing, mad that they couldn't get one thing and leave happy because there was something else that really benefited them and, potentially changed their lives. So thank you all for coming out.
Well, thank you so much, Matt. If there are no other questions, we do want to just thank everyone for joining us this afternoon, for taking your lunch break or, part of your time this afternoon to join us for this lunch and learn with our distinguished alumnus, Matt Zamosky. We do encourage you to continue to check out our alumni website for our upcoming events. We can post a link to our calendar of events in the chat, but also keep an eye out for emails to talk about some of these upcoming events. We are currently taking registration for an event that's taking place this Thursday, April 7th. It is the Sister Mary Schmidt Lecture Series, and that is being co-sponsored by the Alumni College. And then later on in April, on April 20th, the Alumni College will also be co-sponsoring the Farrell Lecture Series, which is being presented by Robert D. Mache, who is a member of the Board of Trustees at Seton Hill University. So we're currently taking registration for those events. If you're interested in signing up, it looks like Ashley has shared a link to our calendar of events, which lists these programs and others. So we want to thank you again for joining us, and we hope you enjoy the rest of your day.